Doctor, you were telling us about laser radiation? Yes, it is an intensely strong, narrow beam of light. It may be used to do what? It may be used to destroy selected skin lesions. The laser means the light amplification by the stimulated emission of radiation. Doctor, what is radiation therapy? In carcinoma of the breast, it is a treatment of value. And what is the value? Well, in selected inoperable cases for palliation. And as an adjunct to surgery, yes, particularly as post-operative therapy following radical mastectomy. Doctor, what is the post-operative recurrence of the lesion? It is frequent. In the management of metastatic bone involvement, there is a radical surgery, which is the treatment of choice for carcinoma of the breast, since it is not possible to eradicate the disease by radiation therapy. However, there is sufficient clinical evidence that irradiation has brought about 5-year cures in patients treated for inoperable lesions. Doctor, the radium therapy is a treatment of choice? Yes, it is. It is a treatment of pathological conditions with radium, which continually emits radiation at a constant rate regardless of environmental conditions. Doctor, what is the superficial X-ray therapy? It is a radiation therapy used for surface lesions, for example, selected skin conditions and tumors. Doctor, in the clinical laboratory, do you do any work? Yes, the substance which produces various allergic manifestations, for example, skin reactions, are tested. And an allergy may be found? Yes, the hypersensitivity to a particular substance is an allergy. Eczema, urticaria, dermatitis due to drugs, or Röntgen rays are forms of allergic conditions. Doctor, what is eosinophilia? Eosinophilia is an abnormal increase of eosinophiles in differential white count present in skin diseases such as pemphigus or certain forms of dermatitis. Doctor, what is desensitization? Desensitization is a process of abating allergic manifestations and making a person susceptible to a substance of therapeutic value by repeatedly giving him small doses of it. And, doctor, the frozen section is what? That is a microscopic study of slides made from fresh tissue of the lesion. It is valuable for rapid diagnosis while the patient is on the operating room table to determine the need for conservative surgery should the tissue section show a benign and not a malignant lesion, or for radical surgery should a malignant lesion be found. Doctor, what is incisional biopsy? That is merely the tissue of the lesion, which is obtained for pathological verification in the laboratory. This procedure is indicated when the tumor mass is very large. Otherwise, excisional biopsy is the method of choice. And, doctor, skin tests for hypersensitivity are small, are they? Yes, a small amount of specific protein is scratched or injected into skin to determine the protein causing food allergy or other morbidities. Doctor, are there several forms of dermatitis? Yes, there are. Is there a bullous eruption? Well, that develops, but they are distinguished from true bullous diseases by a short duration and good prognosis. Doctor, what is polymyositis? Polymyositis is a primary myopathy characterized by muscle weakness in the pelvic and shoulder girdles, the acromioclavicular joint, the distal lower and upper extremities, muscle pain or tenderness. It may be associated with connective tissue disease. Doctor, what is rhabdomyoma? Rhabdomyoma is a striated muscle tumor. And tenosynovitis? Tenosynovitis, also known as tendosynovitis, is an inflammation of a tendon and its synovial sheath. Doctor, what is torticollis? Torticollis is wry neck. And what is wry neck? It is a contraction of a sternocleidomastoid muscle, drawing the head to one side and causing asymmetry of the face. It may be congenital or acquired. What is myoplasty? Myoplasty is the surgical repair of a muscle, for example, by free muscle graft or pedicle graft.
Your pedicle.
All right, ped and then K-A-L.
Okay, how do you spell pedicle?
P-E-D-I-C-L-E.
So why do you write A?
Because Cal, I write Cal. I don't write K-L. Any Cal. I don't care how it's spelled. I look it up later. Oh, you mean if to get the two of them, pedicle? I'm not worried about homonyms in heavy medical. It's enough to transcribe it. See, sometimes with these homonyms, you can get around it by putting in where it occurs, like, say, the word slight. It could be S-L-I-G-H-T, slight, or slight, S-L-E-I-G-H-T, sleight of hand, means trickery of hand. So that's S-L-E-I. So I have in my dictionary sleight of hand, but I don't have the word slight, S-L-E-I. I have the regular slight, because I've eliminated about 90% of the slights. So if I get it once every 10 years, I'll worry about it. I can't even conceive of how I would get it. Slight. But without sleight of hand, that's the expression. So it's, see, what I call rocking chair differentiations, the teacher says, oh, just a minute, slight. Then they don't think of what the realities are out there. Okay. Want to read that? Or not?
Not really.
I got this book, I saw it in Lorraine's apartment. So I said, do you use that book? She says, no. So I said, I'm going to take it and I'm going to give you in exchange, I gave her, I have an extra copy of the Webster's Dictionary. She didn't have one. So, I mean, this ordinarily costs about $75.
What is it?
Oh no, $37.50. Okay. So I gave it to Arnold to time out a few takes. So he timed out 35 takes.
Wow, he's productive.
It's all medical. And I gave him back the speech book because I used them all up. I said, look, I went through about 25 of these. He says, give it to me. I'm going to do another 25. He does it while he sits before TV. Okay. Ready? As strange as it may seem, defining what is outside and what is inside the body is not always easy, because the body has many surfaces. The skin, which is actually an organ system, is obviously outside the body. It forms a barrier that prevents many harmful substances from entering the body. Although covered by a thin layer of skin, the ear canal is usually thought of as inside the body because it penetrates deep into the head. The digestive system is a long tube that begins at the mouth, winds through the body, and exits at the anus. Is food, as it passes through this tube, inside or outside of the body? Nutrients and fluid are not really inside the body until they are absorbed into the bloodstream. Air passes through the nose and throat into the windpipe or trachea, then into the extensive branching airways of the lungs or bronchi. At what point does this passageway stop being outside and become inside the body? Oxygen in the lungs is not useful to the body until it enters the bloodstream. To enter the bloodstream, oxygen must cross through a thin layer of cells lining the lungs. This layer acts as a barrier to viruses and bacteria, such as those that cause tuberculosis, which may be carried into the lungs with air. Unless these organisms penetrate the cells or enter the bloodstream, they generally do not cause disease. Because the lungs have many protective mechanisms, such as antibodies to fight infection and cilia to sweep debris out of the airways, most airborne infections organisms never cause disease. Body surfaces not only separate the outside from the inside, but also keep structures and substances in their proper place so that they can function properly. For example, internal organs do not float in a pool of blood. Blood is normally confined to blood vessels. If blood leaks out of the vessels into other parts of the body, it not only fails to bring oxygen and nutrients to tissues, but also can cause severe harm. For example, a very small amount of blood leaking into the brain destroys brain tissue because there is no room for expansion within the confines of the skull. On the other hand, a similar amount of blood leaking into the abdomen does not destroy tissue because the abdomen has room for expansion. Saliva, so important in the mouth, can cause severe damage if inhaled into the lungs, because saliva carries bacteria that can cause an abscess to form in the lung. The hydrochloric acid produced by the stomach rarely causes harm there. However, the acid can burn and damage the esophagus if it flows backward and can damage other organs if it leaks through the stomach wall. Stool, the undigested part of food expelled through the anus, can cause life-threatening infections if it leaks through the intestinal wall into the abdominal cavity. The mind and body interact in powerful ways that affect a person's health. The digestive system is profoundly controlled by the mind or brain. Anxiety, depression, and fear dramatically affect the function of this system. Social and psychological stress can trigger or aggravate a wide variety of diseases such as diabetes, mellitus, high blood pressure, and possibly multiple sclerosis. However, the relative importance of psychological factors varies widely among different people with the same disorder. Most people, on the basis of either intuition or personal experience, believe the emotional stress can precipitate or alter the course of even major physical diseases. How these stresses do this is not clear. Emotions obviously can affect certain body functions such as heart rate, blood pressure, sweating, sleep patterns, stomach acid secretion, and bowel movements. But other relationships are less obvious. For example, the pathways and mechanisms by which the brain and immune system interact are only beginning to be identified. It is remarkable that the mind can alter the activity of white blood cells and thus an immune response, because white blood cells travel through the body in blood or lymph vessels and are not attached to nerves. Nevertheless, research has shown that the brain does communicate with the white blood cells. For example, depression may suppress those more susceptible to infections, such as those by the viruses that cause the common cold. Stress can cause physical symptoms even though no physical disease may be present, because the body responds physiologically to emotional stress. For example, stress can cause anxiety, which then triggers the autonomic nervous system and hormones such as epinephrine to speed up the heart rate and to increase the blood pressure and the amount of sweating. Stress can also cause muscle tension, leading to pain in the neck, back, head, or elsewhere.